All right. First of all, I need to refresh your knowledge before we starting chapter 6, which is for today, how to interpret the EKG strip. So in like short time, I would like to refresh your knowledge for everything, from everything like going to be as you know, today our chapter is going to talk about interpretation of EKG strip. First, we need to know that the pacemaker, like we had yesterday, is either primary pacemaker or secondary pacemaker or Purkinje fiber. The first pacemaker for normal person fire at a rate of 60 up to 100 beats per minute. And the second pacemaker, which is AV node, fire at a rate of 40 to 60 beats per minute. The third one will be the Purkinje fibers, and the Purkinje fiber will going to fire at a rate of 20 to 40 beats per minute. This number one. Number two, I need everyone to remember where is the location of SA node. If you remember from yesterday, we mentioned that the SA node, S stands for sinus or sino, A stands for atrial, and node. What is the location? We realized yesterday it is located at the junction of superior vena cava with the right atrium. Then also we mentioned where the AV node, we mentioned that the AV node at the floor of the right atrium, just above the tricuspid valve. Okay, and then we mentioned that we have from the AV node, we have a bundle of Hess, and the bundle of Hess is going to get two branches. The one going to the left ventricle called left bundle branch, and the one going to the right ventricle we call right bundle branch. Okay, so this is very important. What else we need to know about information we are going to use today? As I told you, it is very important to recognize the interval. We have two important intervals. The first one is PR interval, and this PR interval indicate the time conduction of impulse from SA node to the AV node. And according to this, it will make atrial contraction. Okay, then we have another time, which is the QRS. QRS normally should be less than 0.12 seconds. And this very important for what? Less than. Because if it is equal 0.12, it will be another diagnosis. But the normal one should be less than 0.12 second. If we mention this 0.12 second or the PR interval range, which is between 0.12 to 0.20 seconds, we can make it in like small box, and the small box for PR interval range between 3 to 5 small box. The normal QRS should be less than 3 boxes. Clear? Then, this is like the most important topics. We talked about this yesterday, and for other point we are going to discuss is when we look for the time. We mentioned before, for refreshing your knowledge, that the small box time is 0.04 second, and the big square or big box time is 0.20 second. So this is regarding the horizontal direction, which is for time. The vertical direction, we mentioned it is for millivolt. And if we have 10 small boxes, it will be 1 millivolt. And this millivolt is like the strength of electricity coming from the heart. And the highest wave is the R wave. Let us go to understand what should we know about this chapter, chapter 6. We need to understand what we are going to know. We learned together during the lab time that the first wave is P wave. Then the second wave is Q. The third is R. The fourth is S. And the last one is T. And we mentioned also that P, R, and T are positive reflection. Q and S are negative reflection. We mentioned that we have standard leads, which is lead 1, lead 2, lead 3. And after that, we have the augmented leads, which is AVR, AVL, AVF. And then we have the precordial leads, which is from V1 to V6. And we practice on lab that how we plate the electrodes. And I think most of you already watched the video for how to plate the electrodes for one of your classmates. Let us see what should we know for today. As I told you, we have a wonderful book, and this wonderful book giving you how to go with every or whatever strip in the world. What should you know? We have what we call 5-step systemic approach. 5-step systemic approach. This means what? I have to look for these 5 items. These 5 items, I will answer one by one, and by the end, I will find myself, I can diagnose what is this strip. First of all, before we starting any EKG, it is very important for you as a medical assistant is to do what? To look at your patient. Maybe your patient is in critical situation. So what is the benefit to do EKG while the patient is dying on the table? So first of all, be sure that your patient is already in a good health, in a good situation. He can like stay alert, stay comfort, stay cooperative with the procedure of EKG. So what are the 5 steps? We are going to learn together what these 5 steps, and we are going to learn together what is the normal, and after that we go one by one. First step is the heart rate. So like I told you, all the new machines, it provides you with all this information about the number, about regularity, about, but in the exam, certification exam, they give you, and we are going to practice by the end of this lecture, how to go to answer these 5 questions or 5 steps. And according to this, we can reach the analysis to the maximum, and we are going to be professional. First step, heart rate. If I ask you, what is heart rate? Like the pulse. We mentioned that the normal heart rate range between 60 up to 100 beats per minute. Okay, so this is the first item. If we find any variation will be added to this description. So if I find that the heart rate range between 60 up to 100, this will be normal heart rate. If it is increase or exceeds 100, we will put the word tachycardia. Tachy means fast, cardia means heart, so the heart is running more fast. If the heart rate is less than 60, I will say the opposite to the tachycardia is bradycardia. Brady means slow, cardia means heart. You got it? So this is just give you like the main frame to be like oriented about what should we do for such kind of study. Number one, the heart rate. We have to know what is the normal. If it is above normal, will be tachycardia. If it is below normal, we will say bradycardia. That's it. Then the second step, we are going to mention, is it regular, which is the heart rhythm. What we mean by the word rhythm, it is regular or irregular. If you remember my experiment, which I did during the class, is when I make like, you remember? So this is what regular. So if I find regularity, I will say this is regular. If it is irregular, I will mention irregular. And what will be the guide for me to tell this is regular or not regular? I'm not going to listen to the sound with the paper. So how can I detect that this is regular or not regular? If I find the distance from R to the next R, to the third R, to the fourth R, the distance are equal, almost equal. So R to R distance is constant or almost constant. Okay, so the key word for regular or irregular is R to R distance. If it is fixed or almost fixed, I will say that this heart rate is regular. If it is varies, coming closer, coming faster, it will be irregular. Are you following? Any question? Okay, so what after that? After that, we have the P wave. Of course, the P wave is very small wave, like we watch with the experiment we did in the lab. P wave is small, you say, but it has a character. What is the character? Number one, upright. Number two, smooth. Number three, like upright is positive. So upright or positive, it is the same. So positive or upright, smooth, and precede URS. Are you following? Any question? So what is the criteria of P wave? We mentioned the normal one should be upright or positive, smooth, and precede URS. What about the fourth step? I need to look for the PR interval. We mentioned what is the PR. It is the distance from the beginning of P wave till the beginning of QRS. And we mentioned that the normal value of PR interval, it is from 0.12 to 0.20 second, or in another word, from 3 to 5 small boxes. I'm talking very slowly to follow me, okay? Then the fifth step is the QRS complex. What we need from the QRS complex, we need the following. Like I told you, notice R wave. It is sharp pointed. Number two, what is the distance between the beginning of Q till the end of S, it is less than 0.12 seconds or less than small boxes. Clear? All right.
Wait, Doctor, can you repeat that last part?
So when we start to go into analysis for each step, this is here. We mentioned that the normal is 60, like 60 to 100, the normal heart rate. And we are going to count the heart rate in a minute, 1 minute. And we mentioned, of course, 1 minute, it needs from me, anyone can answer this question, how many big boxes or big square in 1 minute? Let me listen to you.
$1,500.
This is small boxes. $1,500 is 1,500 is small boxes. What about big boxes?
300.
300, very good. So are we going with full minute, or as I told you, it is impossible to have 300 big books. So what we are like, make it short.
30,
So
30.
say it again, Yusina.
30, you do the 6.
30, which means 6 seconds. Very good, very good. Okay, now we are going to talk about the atrial rate. How can I count the atrial rate? We know that P wave represent atrial contraction, right? So if I count how many P's in 6 seconds or in a minute, whatever, so I will say that atrial contraction is like 75 beats per minute. Okay, what about the ventricular rate? It is just see, we are going to count how many QRS in 6 seconds or in full minute. So atrial rate should equal to ventricular rate, like we did before the example that atrial and ventricle are working following each other, and the time between atrial contraction till ventricular contraction is 0.05 second, if you remember from yesterday lecture. So how can you count? Why we are going to, because in the future lecture, we will find that the number of P exceeds the number of QRS, which is serious condition within like atrial fibrillation or in heart block. So normally it should be equal to each other. When I count this, it will be equal to the QRS complex. Then we repeat again that the SA node fire 60 to 100 beats per minute, and if it is less than 60, it will be the word bradycardia. If it is exceed the 100, it will be tachycardia. I hope everything is clear for you now. How we detect, of course, as I told you, that all devices all over the world now give you this number without your methods to count it by yourself. But in the exam, and also we are going to practice together by the end of our lecture today, how to make it by ourselves, which we call manual. The 6 second method. I told you the 6 second is represented by 30 big square or 150 small square. So this is very nice. And we mentioned also that we have to count how many R or QRS, because QRS represents the ventricle, and we make it shortcut. We say it is only like R. So we are going to count how many are in 6 seconds, and then we are going to multiply it by 10, and this will give us the heart rate in a full minute. We practice on this step when we were in the lab and before that time. Let us have this first example, and of course, I need one of you to share with me. I'm not using the headphone because it makes echo to me. So recorded video will come back to me. So I hear myself, and this interrupted me. So this is what I need: someone to go with me. And first of all, what do you think? How many big square here? Actually, you have to note that it is coming as a fixed. It is 30 big square. If you count it, you find that it is 30. Let me help you for that to go very clear. I don't need anyone to get confused. Okay, let us count. 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You got it? Are you following? So this is 30 big square, and this big square represents 30 big square represents 6 seconds. So let us count together the number of URS. So would you please, I need to refresh your knowledge at the same time. Okay, who will participate with me? Let me ask you, one of you, okay, what this wave?
P.
Very good. Again, what this wave?
P.
P. Very good, very good. And this?
E.
E.
Very good. So all the green arrows are P wave, and we know what is the criteria of P wave. Very good. If I ask you in the opposite direction, what this?
T.
T.
Say it again.
T.
And this?
T.
T.
T. What this?
T.
T.
Very good, very good. So these waves, which we have in green arrow, this 3-1 is P, this 3-1 are T wave. Very good. Let me go with our target for today is this one, which is R, which represent the ventricular contraction. This is R, this is R, and this is R, and this is R, and so on. So let us count. 1, 2, 3, 4, 5, 6, 7, 8. So we have 8R and this 6 seconds. So what will be the heart rate? As you see here, this is the correct answer. 8R times 10 it will be equal 80 beats per minute. Clear? So this is the first method for us to calculate the heart rate. And you have to also learn from this strip that what you think, guys, this heart rate is regular or irregular? I told you the rule of regularity or irregularity is depending on the distance between R and R. So here, the distance from R and R here, it is the same like here. It is the same like here. Of course, I am pick one and leave one. Okay, so all of them, if I make like this to make not confused. So all the blue line almost the same. Okay, so if the distance between R and R and R and R are the same, it is called regular heart rate. You got it? All right. So let us go with something also important. If I ask you the third step about P wave, so what do you think? P wave is normal? Yes, it is normal. Why? It is smooth, upright, and each P wave precedes QRS. You see, P wave before QRS, P wave before QRS, and so on and so on. So this is normal P wave. Then we are going with PR interval. We mentioned that the PR interval is starting from, let us make it fine line. Okay, starting from here, this is the start of P, and here the start of Q. So this start, let us count. If you have good, I need everyone to count with me. It is 1, 2, 3, 4. So it is 4 small boxes. Can you see it? The PR interval here is 4 small boxes. And we know that each small boxes is 0.04 second. So this means the PR interval is 0.16. So it is within the normal range. Then if we go from the Q till the end of S here, and we count, it is like less than from here, it count like just 2 small boxes. So it is 0.8, which means it is less than 0.12 second. So the QRS is also within normal. So what is the conclusion? The conclusion is you can say for now, normal EKG. And we are going to learn from chapter 7, what is the name for normal EKG? It will be sinus rhythm. We will touch this in chapter 7. But so far now, this is very good example for every one of you to be like, train yourself how to go like I did with the 5 steps. I will repeat the 5 steps again. Step 1, I need everyone to make like a small paper and stick this small paper in front of you when we are going to practice on strips to answer the 5 questions in order. Number 1, the heart rate, we did. Number 2, it is regular or not, we did. Then the criteria of P wave, then the criteria or the time of PR interval, and lastly, the QRS. When you finish these 5 steps, you will be professional, reach the diagnosis. And we are going to go step by step to play, sorry, to play with this criteria. And if this criteria is going to be changed, we will get definition of new disease. Before we proceed to the next slide, do you have any question?
What are the 5 steps again?
The 5 steps. Number 1, what is the heart rate? Number 2, what about the heart rhythm? It is regular or not regular? Number 3, what is the P wave? Number 4, what is the PR interval? What is number 5? What is the QRS interval or complex criteria?
Doctor, could you go over the PR interval and the QRS interval too?
Sure.
Yeah, for the 4th step, you said the distance from the beginning of the PRI interval to what?
Okay, now I'm repeating for the PR interval. We mentioned that the PR interval start from here, beginning of P here. Sorry, not this one. Sorry. So what is the beginning? The beginning of P here. And here it is the beginning of the QRS. So between these 2 arrows, you can count how many small square. You find that there are 4 small boxes. And we know from previous lecture that the small box time is 0.04 second. So I will multiply 0.04 times 4. It will be 0.16 second. This means it is within normal distance or normal time. Clear? What about the QRS? Let us have another one. Here we mentioned that the Q is starting here and the S and here. If we count how many small square, you look here, it is like 0.8. From where I get this 0.8, it is 2 small square. And we know that the normal should be less than 3. And we know that the small square is 0.04 second. So this distance of QRS is 0.8 second, which is also within the normal criteria of the QRS. Okay. Any further question? Then we have another method to give us information about the heart rate. We learned the first method is the 6-second method, which we apply it for regular heartbeats. The second one is for RR interval to let us what is the time. RR interval, we can do it in 2 ways. If we calculate how many big square or big box between R and R, and I will going to divide 300 by this number, I will get the heart rate. The third method is also the RR interval, but we use the small boxes between R and R, and I'm going to divide 1500 by this number, and it will give me the most accurate. If I go back to let you know about this issue, pay attention, please. Here I am in the back of these slides. So second method say that I am going to count how many big square. Let us have this one, for example. So here is one big square, two big square, three big square, and almost four big square. Almost. It is not accurate 100%. So almost it is like four big square. If I divide, you can use your cell phone. Divide 300 by 4, you will get like the number is 75. Okay, which is so close to this one. You remember? So 75 is not accurate 100%. Why? Because it is actually not fully 4 boxes. Okay, so if I need to make it more accurate, let us count together the small boxes. Pay attention with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. So we have between R and R almost 23 small box. Use your cell phone also and divide 1500 by 23. What is the outcome number?
65.21. So 65.
65. So this is like giving us another number. So the most accurate one is to go by the small boxes. This is the most accurate, and it is applying for the regularity of the heart also. It gives us like the number is fixed all the time, so it will be the most fixed one, give us impression that it is regular or rhythmic. So we have 3 methods to get heart rate. The first one we call 6-second methods, which is you count how many are in 6 seconds and you multiply by 10, which is the most easiest one, and we practice this very easy. The second one is to count how many R to R distance in big square, and you are going to divide 300 by this number. And the third method, you count the small boxes between R and R, and you divide this number by, or divide 1500 by this number, you will get the most accurate technique for the heart rate. And our machines we are going to use is doing this like the average, like we practiced on last week, that we find that the machine count sometimes the heart rate going up, going down, and it give us like the average, and it print the average on paper. So we have 3 methods to go by the heart rate. Here another technique, which is like another strip. It looks like the previous one, and if I ask anyone what will be the heart rate for this, let us go by the 6 methods, and the 6-second method. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 R in a 6 second. So what will be the heart rate? Definitely we multiply by 10. So the answer is 100 beats per minute. Okay, you got it? And we can go by the second method, which is count how many are distance in big squares. So let us see, like here, 1, 2, 3. It is almost 3. It is almost 3. You see, you can count. It is almost 3. So what you think? Divide 300 by 3. So we will get what? 100, which we got it by the first method. Clear? And the third method, this almost 3 small square is like here, if we count, they are 15 small square. So what is the third method? I am going to divide 1500 by 15. I will get the answer, which is 100. So the 3 methods come to me with the same number, which is the heart rate is 100 beats per minute. Is it clear? All right, very good. Then the second step, as we know, is the rhythm, and the rhythm can be simply, I need you to go over it as a simple, regular or not regular. How can I judge if the R is fixed or almost fixed? I will consider this is regular. If it is come wider, come narrower, it is irregular, like in certain disease we are going to face in the next chapter. So just for the heart rhythm, I need you to say regular or not regular, because sometimes we have to mention that it is regular irregularity or irregular irregularity. So don't get panic for the name. Just I need you to know regular or irregular. That's it. Okay. Let us have example about this strip. As you see, the distance between R to R is almost fixed. So I will say this is regular EKG strip. If we go, like we have a variation, which is 1.5 small box. So if I have this variation, I can consider it is regular. And if it is irregular, it will be like this. This is one is very okay. And here, the irregular irregularity, the RR intervals exhibit no similarity. Clear? So here we have a practice for the heart rate and the rhythm. So if I ask one of you, let me know what will be the heart rate here. Hmm?
$60.
Very good. Okay, so this heart rate is 60. Very good. What is the heart rate here?
80.
Oh, wait, 80.
Correct. Correct. 80. Very good. Then the third method or the third step for analyzing any strip is to talk about the P wave. And we know that the P wave should be smooth, means rounded and upright, and it comes from the SA node, and it should precede QRS, or we can say that every P has to follow by QRS, or QRS has its own P wave. This means the heart is working correct, because as I told you, in the future we will find that P waves may be more than the number of QRS. And we know that the P wave shape looks like this. And then let us answer this question, which is very important. P waves are present, yes or no? Number 2, are P waves occurring regularity? Yes. Number 3, is there one P wave present for each QRS complex? This means yes. So if I answer these 3 questions by yes, this means P wave is okay. P wave is normal. You got it? Like we mentioned, it is smooth, upright. So far, if it is present, so we can describe it. But sometimes when we get in the future that P wave is absent. we don't find P wave. Or the P wave is like coming after the QRS, which is abnormal. Or the P wave is inverted. Inverted means negative, not upright. This is also abnormal situation. So when we answer these three questions by yes, this means everything is okay with the P wave. Then what about it is like smooth, like we mentioned, and let us say that all P waves looks like similarity, because if they have n similarity, we will get like more than one source of electricity within the heart. We call ectopic focus. So we will find this when we practice. All right. Let us practice here for the P wave. Actually, this is, we practice with normal. So don't consider this is normal, but you have to adapt yourself and adapt your eye to see normal. So we mentioned, and you are very good about that this is P wave, and P wave precede the QRS. P wave is upright and smooth, and we find that each P wave is followed by QRS. P wave, QRS, P wave, QRS, P, QRS, P, QRS. So everything is okay with this P wave, and according to this, we can continue. The four steps, or the fourth step for interpreting the EKG strip, is to count the PR interval, and we learned before that the PR interval should range between 0.12 to 0.20, and this is very important. As I told you before, you have to keep focus on this number. Never forget it. And interpretation of this number is either to say that between 3 to 5 small square, but in the exam you have to mention the time, not only small square or how many small square, because the exam needs you to be aware about the time actually. And this is the PR interval, how we measure it. And after that, we need to ask ourselves about the PR interval. It is greater than 0.20 or not? It is less than 0.12 or not? It is the PR interval constant. Constant, this is very important, constant. So it should be all the way throughout the EKG, should be constant, because we are going to have degree of heart block, Mobis type. It will be like increasing, then it will leave drop. So all what we are mentioning now is like we repeat many times normal values. So this normal values has to be like printed in your brain, easy to recall. Put it in front of you all the time. So far, we are taking the lecture. Put all this information in front of you to give you good guide. The PR interval practice strip, if we count, we did this before, we have to start from the beginning of P, like here, till the beginning of QRS, and you count how many small square, and you multiply it by 0.04, you will get the time for PR interval. And this is the last step, which is how to measure the time for QRS. And we know, again, the normal value, less than 0.12 second. And it consists of Q wave, which is negative, R wave, which is upright positive, and then S wave, which is also -1. And the time is very important. It will guide us for serious situation within the ventricle. So if it is bigger than 0.12, pay attention. If it is bigger than 0.12, I will give her the name wide. If it is less than 0.12, it is the normal. I will say it is narrow. So from now, adapt your ear for this pronunciation or description. If I tell you this is wide QRS, you understand this is abnormal. If I say narrow QRS, this means it is normal. So adapt yourself about the following. Wide means abnormal. Narrow, it will be the normal one. And here we are having like practice for QRS rhythm, QRS practice. So you can also practice, you have these slides as a PowerPoint. You have also these slides available in your book. So practice on your book is very important, very helpful, and by repetition, you will be so professional. And after that, we are going to have certain variation, but I don't think you are in need of it for your level of education. But all what we need to know is the ST segment. ST segment is very important. Sometimes we have like a kink here. We call J point. J point between the end of S and the beginning of T, we call J point. And we learned yesterday that ST segment may be elevated, may be depressed below the isoelectric line, and according to this, it will be indicating myocardial infarction. FST segment, as you see here, is elevated or depressed. Myocardial ischemia or injury may be indicated. And this is very important, as I told you, when we have a patient in emergency room and we find that ST segment elevated, so we have to admit them into intensive care unit for heart attack, okay? Like we mentioned, T wave represent repolarization of the ventricle or relaxation of the ventricle, and it should be positive all the time. If it is inverted, it will also means that there is infarction happen to the ventricle. When we are doing EKG, like I told you, we have to be careful about to avoid any artifact, like electricity can do artifact, coin or metal attached to the body can do artifact, the liver can do artifact. We have many sources of artifacts. You can read it here, that what are the causes of artifact. Like I told you, let the patient completely relax. Let the patient completely relax, not talking, not moving, not laughing, not get cold. So patient movement, loose or defect electrodes, improper grounding, and faulty EKG apparatus. All of these can be or can lead to artifact. Like here, look guys, this is not simple EKG strip. You see these lines, dark line, this one, you see? All of these are like trying to make the wave, but with artifact. Like the patient is having metal attached to his body, or the patient feel cold, shivering, or there is like cell phone so close to the machine. So it gives us something like that. We call this is not accepted EKG, because we can't go by any wave to count, to describe. It is make no sense. We done with our chapter today. And let me stop recording.